Welcome back to State of the Nation. The Lagos State Commissioner for Health, Mr. Akin Abayomi, said that the government has commenced inquiries into an alleged illness in Queen's College and other state-owned schools in Lagos, where an epidemic of respiratory nature has occurred. Take a listen.
We've identified that there were about 90 students in Queen's College that were affected by this supposedly virus, which we're not sure what its identity is yet. As a result of the slight excess in numbers of children that were falling sick in that boarding school, I think parents felt the need to withdraw their children. So hence, the numbers that we're seeing in the media of about 700 children leaving the school. Now, 700 doesn't mean 700 children were sick. It's just 700 children were withdrawn by their parents, which is not a bad idea. We've been there. As of today, I've just got my report from my team that are on ground. We've been taking samples, and the samples have been sent to the reference laboratory. The numbers of children that are presenting with these illnesses is significantly subsiding. We've done a very careful inspection of the school environment. While we found some deficiencies, we feel that they have responded to our recommendations that were made in the subsequent event that happened a couple of years ago around the outbreak of waterborne infection. Now, this is not a waterborne infection, this is an airborne infection. So we're confident that we're on top of the situation. We will have some results soon. Most of the children have recovered, and there is no reason at the moment for any alarm.
Lagos State Commissioner for Health, Dr. Akin Abayomi. Now, joining us to analyze this is Dr. Lawal Bakare of EPID Alert in Lagos. Many thanks indeed. He joins us via Skype. Many thanks indeed for joining us. Why has this disease resurfaced? It's less than a year after it occurred in Queen's College, which led to the death of a student. And this is happening again. Can you hear me? If you can hear me, I'm just asking you, why has this occurred again, despite the fact that we saw the similar scenario less than a year ago, and this is happening now again, which led to the death of a student when it happened the first time? What's happening? We seem to be having an audio problem there with our guest who's joining us via Skype to try to understand the magnitude and how much we are as a country and as a state, it's a matter of fact, in Lagos State, dealing with this viral disorder that we have. We did hear the Commissioner for Health, Mr. Abayomi, made mention of some of the steps that the state government is taking to try to address the concerns in the state and especially in Queen's College. But let's get back to our guest who is joining us via Skype, Dr. Lawal Bakare. Can you hear me now? I'm just wondering, though, that this disease, which we saw less than a year ago, has now occurred again in Queen's College, which led to the death of a student previously. What is going on? Is this the same strain of disease that we recorded in less than a year ago? Okay, as quickly as we can resolve that, but that's the information that we're getting. The state government is making efforts to try to see that those cases are reviewed. Also, 90 students, we understand, have been affected by this, and the state government is trying to ensure that they get the best kind of attention they can. And the viral infection, which we understand it is of respiratory nature, is being nipped as quickly as possible. Let's try this once more and see if it gets through to our guests by Skype. I want to thank you so much indeed. If you can hear me now. Okay, my directors are telling me we're going to have to resolve this now. We'll take a short break and we'll be back after these messages. Join us again. Don't miss it. Okay, let's try this one more time. Welcome back. Dr. Lanre Bakare of EPID Alert joins us via Skype. Can you hear me now?
Yes, I can. I can
Brilliant.
hear you.
I missed you almost 3 times in a row. I was beginning to wonder what's happened with your earpiece. But
Yes.
this scenario that we're looking at in Queen's College in Lagos, it did happen about a year ago. It's happening again. What's the problem?
Okay, so the events of last year and this current event are not the same. Last year it was a diarrheal disease. This time it's an upper respiratory tract infection type of symptoms that were reported. There is no linkage between what happened last year and this year. But what is constant is that a particular single school was affected last year, and this same school is in the news for an outbreak this year, which is something of importance to everybody that is following these developments.
So let's look at this deeper. The Lagos State Ministry of Health, that's the surveillance team, has identified what appears to be that sporadic increase in upper respiratory tract infection, as you did mention. And that's characterized with coughing, catarrh, fever, weakness. Now, that's suggestive of symptoms of malaria, isn't it?
Well, definitely malaria will start with fever, definitely present with general body weakness, among other things. But in this case, there was evidence coughing, so which is one of the things that helps to differentiate that. Yes, there's the airborne factor to it, and there's upper respiratory tract infection type to it. So definitely the cough part of it just helps to differentiate in terms of symptoms from just typical malaria.
What should the institution be doing now, in your view, and especially when we hear from the Lagos State Ministry of Health saying that some other schools could be affected in this since it's an airborne thing, more schools could be involved in this. What should other schools be doing in terms of taking precautions and perhaps trying to look for a solution to it?
Very good. So the first thing is that because it's an upper respiratory tract infection, usually they are viral and they are self-limiting. So ideally, if the environment is properly controlled and if the first child that probably showed the symptoms was removed from the school environment quickly, there's a chance that this wouldn't have transmitted from another child to more children in the school environment. One of those things that we feel schools should do very fast is linking up with local surveillance systems. In every local government in Nigeria, there's a local government disease surveillance officer. When the school starts seeing this kind of thing, they shouldn't just continue to look at it as a clinical event, because there is a clinical side to it, but there's a public health side to it, which is why they need to notify very fast their local government disease surveillance officer. That would have helped to bring the type of coordination that Queen's College is now enjoying, where the Lagos State government and the local governments in the region that they are situated are now able to support them in looking deeper at what is going on and probably providing solutions very fast. The other issue that is of importance is the sanitation of the school environment. There are several protocol guidelines that schools can easily borrow to protect the environment that children are schooling in and living in. Because Queen's College is a boarding school, which even is a more complicated situation than just any other type of schooling system where it's just day, students go home in the evening. This one, children live in those environments. It's important that they improve sanitation. Improving sanitation is very simple again. There is a local government environmental health officers. There's a local government medical officers of health. They can partner. They can partner with the State Ministry of Environment and State Ministry of Health also in this regard. There are guidelines to protect the environment that children are schooling in. We can go into the details of that. But this is showing that whatever the environment looks like at Queen's College, sanitation is probably one of the big issues that they are going through. These issues of sanitation and pollution does not only talk about cleaning the environment, but it also talks about regulating the amount of people that are in a space, to look at how do you optimize for the number of people in that space so that diseases don't transmit very fast. The school may be overcrowded at the moment. What do they do to the number? What do they do to optimize the space? Are they going to expand the location, but we probably have more campuses? Are they going to minimize the number of students that they are bringing in per time? These are kind of broad composition, but these are kind of things that we think the school can start leveraging.
That's a good place to let it rest. I must sincerely thank you for sharing your thoughts with us on this very disturbing situation also that we're seeing in Queen's College and by extension some other schools within that access. Dr. Lawal Bakare of EPID Alert, thank you for joining us on State of the Nation.
You're most welcome.
And indeed, 0802337747 is what the state government puts as its hotline for this very emergency situation. If you can reach it, please do. That's it on State of the Nation. Many thanks for watching. I'm Gimbo Umar. Bye for now.